Here's what happens when you stop smoking tobacco. It is estimated that smoking causes more than 6 million deaths around the world every year, and current trends suggest that tobacco use will cause a staggering 8 million deaths by 2030. Smoking is the #1 preventable cause of death in America, and as many as 16 million people suffer from a disease caused by smoking, such as cancer, heart disease, stroke, lung disease, and diabetes. So what if you stop the habit? What is the reversibility of these risks? Today, we will explore that in this episode of ShowMaster. In addition to the fact that smoking is bad for your health, there are other reasons for you to stop. It's expensive, your hair and clothes stink, and in some places, it's considered unacceptable. In restaurants and bars, it's forbidden, so you have to go off-site. Kicking the habit has many benefits, but how will it affect your health? As time passes, how will your body change since you have stopped smoking? 20 minutes. Your body will have already begun to repair itself in under 20 minutes while you are commuting to work. Once you stop smoking, your pulse and blood pressure drop, circulation improves, and your hands and feet warm to their normal temperature within 20 minutes. 12 hours. Carbon monoxide, shown as a harmful gas in cigarettes, is one of the known toxins in cigarettes. As it prevents oxygen from entering the lungs and blood, this gas can be fatal in high doses. After a 12-hour period, your body's carbon monoxide level is back to normal, so your heart doesn't have to work as hard to pump enough oxygen to your body. However, at this point, you will be experiencing withdrawal and cravings. Chewing gum or sipping water can help you combat these feelings. 24 hours. You're at the 1-day mark. Well done. It's good to know that the blood pressure begins to drop after just 24 hours, reducing the likelihood of heart disease and blood clots from leading to stroke. Smokers are twice as likely to suffer a heart attack as non-smokers, and the risk is already significantly reduced after just 24 hours. Increased levels of oxygen also make physical activity and exercise easier. 48 hours. 2 days in is the perfect time for a tasty snack. The nicotine in cigarettes damages the nerve endings, and after just 48 hours, your senses will become sharper as nerve endings begin to heal. During this period, mucus from your lungs will be expelled by your body as it undergoes a detoxification phase. Unfortunately, this is when the most intense withdrawal symptoms happen. A heavily smoked person might experience dizziness, anxiety, and fatigue. Additionally, you may feel a stronger compulsion to eat than usual. 3 days. The nicotine levels in a person's body are depleted after 3 days. A person feels much more healthy after removing nicotine from their body, but initially this also worsens withdrawal symptoms. After 3 days, many people get moody and irritable, experiencing severe headaches and cravings as their bodies readjust. Positively, your energy levels will increase and you will breathe more easily. Major improvements occur during the first 3 months. After a couple of weeks, the cravings will subside, and the chance of going back to the habit will decrease greatly. Your lungs become stronger and clearer, and your blood flow increases. Exercise can be done without huffing and puffing so much, and the risk of heart attack is reduced even more. 9 months. There will be significant changes in the body 9 months after giving up cigarettes. The lungs have significantly healed themselves. Smokers' cilia, the delicate hair-like structures that shield the lungs from infections, will have recovered from the damage caused by cigarettes. Most former smokers experience a reduction in lung infections around this time because the healed cilia can perform their tasks without difficulty. With the help of a deep breath, as well as energy levels that are back to normal, you'll find it much easier to perform. 1 year. This was a big milestone with the habit in the distant past. The time has come to celebrate the achievement. The risk of heart disease has decreased by half and will continue to drop beyond this 1-year mark. 5 years. After 5 years without smoking, the body has healed itself so that the arteries and blood vessels begin to widen again. This means blood is less likely to clot, which lowers the risk of stroke to the same level as a non-smoker. And compared to when you first quit, you're half as likely to get cancer of the mouth, throat, esophagus, or bladder. 10 years. Lung cancer is one of the greatest risks a smoker faces, and after 10 years, a person's chances of developing lung cancer and dying from it are about half compared to a smoker. 15 years. And finally, after 15 years of not smoking, the chances that you'll get heart disease are the same as if you never smoked at all. Your body has done a huge amount of recovery and healing, rejuvenating the tissue and cells. From the first few weeks of headaches and discomfort to a fully healed body, a long path, but the rewards are very real and clear. There's no real argument to be made for continuing to smoke. As well as the changes to your health, your immune system will also improve, your hair may become thicker and fuller, and your skin will age less quickly. But of course, it's never easy, particularly during the first few days and weeks. So, have you quit smoking? If so, how did you manage to do it, and has your health improved? Let us know in the comments. Thanks for watching, and as always, don't forget to like, share and subscribe ShowMaster.